Hi, I'm Rachel Baker. I'm the nurse researcher for TriHealth, and I've been at TriHealth just over 5 years. And I'm excited to be here today to talk about the COVID-19 vaccines with Dr. Blatt and Dr. Coppage, so I will let them introduce themselves.
Thanks, Rachel. Hi, I'm Dr. Stephen Blatt. I'm the medical director for Infectious Diseases for TriHealth, and I've been at TriHealth for over 20 years.
Hi, I'm Kristin Coppage. I'm the System Chief for Women's Services here at TriHealth, and I have been here as a maternal fetal medicine physician for 16 years.
So COVID-19 has been part of our lives for about the past year and a half, and people still have lots of questions about the vaccine, the variants, and the virus itself. So we're here today to chat and answer some of those questions. Dr. Blatt, can you start with telling us a little bit about what the symptoms of a COVID-19 infection look like?
Yeah, so the symptoms are really the same as they've been throughout the whole pandemic. Most people have start out with a sore throat, maybe a fever, headache, then they get muscle aches. Fatigue is really a prominent symptom, very extreme fatigue. Then they start developing cough, sometimes shortness of breath, and people who get sick enough have to go in the hospital to have their oxygen supplemented because of low oxygen levels. And some patients even end up needing ventilator support at some point. So it's a really serious respiratory infection.
So with what we know so far, how can we best protect ourselves from contracting COVID-19?
Yeah, so the best protection by far is getting a vaccine. So we know the vaccines are highly safe and effective. All three of the currently FDA, either emergency use or fully FDA approved vaccines are highly effective at keeping patients from getting sick enough to need to be getting admitted to the hospital or dying from the disease, so they're very effective.
Great, and I've done a little research into how the vaccines work, and some people weren't aware of how vaccines work, so I think it's important to talk with people about what they do when vaccines are introduced in our bodies. And how I think of it, we'll see what you, think of this, is that the vaccine kind of introduces our body to what to look out for. So it gives us a little cheat sheet ahead of time. And then if we're exposed to the virus after being vaccinated, our body is ready with an immune response and ready to fight right away, which could mean we don't get sick at all, or it could mean we get a mild sickness, but much less than if we weren't vaccinated and our body wasn't prepared to begin fighting right away.
Yeah, that's absolutely correct. So the mRNA vaccines, Pfizer and Moderna, have a little tiny bit of genetic material that introduces your body to a protein made by the virus called the spike protein. And so your body recognizes that, develops antibodies. And the next time you see COVID, if you actually come across an active COVID infection, your immune system responds quickly. It increases its antibodies, it binds up the virus and clears it out of your system, so hopefully you don't get sick at all. It works really well.
Some people have talked about side effects that they get after the vaccine. Can you talk a little bit about what we can expect to see after getting the vaccine?
Sure. So most people get a little bit of a sore arm. Some people get a little bit of a fever for a day or two. Some people get a mild headache. But generally, the side effects from the vaccine are gone in 48 hours. It's just your immune system's response to recognizing a foreign protein or a foreign substance from the virus that it's telling you, yeah, my immune system's working. It recognizes this, and the next time I run across it, I'll be protected.
Great. When you talked first about the vaccine, you talked about some of them having emergency use authorization and one being fully approved. Can you talk about what those mean?
Yeah, so when a new vaccine is developed, the clinical trials, the studies, compare patients who got the vaccine to those who didn't get the vaccine and see how many patients get infected with the virus. And it takes over a year to gather all that information and for the FDA to evaluate all the data and say, yes, this is a safe, effective vaccine. We know what kind of side effects to expect, and we know that it actually works very well. So the first vaccine that was studied was the Pfizer vaccine. And those studies are more than a year out now. They're close to probably almost a year and a half. The FDA agreed that the data looked good and fully approved the Pfizer vaccine. The Moderna data has been submitted to the FDA, and that one we expect to be fully FDA approved probably in the next month or so. And the Johnson & Johnson vaccine's just a little bit behind that, and that will likely get full FDA approval probably sometime in the fall.
Great. So switching gears a little, Dr. Coppage, I've heard from many team members who are pregnant or planning to become pregnant soon and are concerned about both potentially contracting COVID-19 and about any risks that there would be with getting vaccinated during pregnancy. So can we start with talking a little bit about risks if someone who is pregnant or planning to get pregnant contracted COVID-19 infection?
That's a great question. So when pregnant women get respiratory viruses, because of the physiologic changes that go on in their body, they're at higher risk for complications from those respiratory viruses. So whether you're talking about the flu or COVID, they're at increased risk for complications. And so we know when pregnant women have COVID-19, they're at increased risk for being hospitalized, for being in the ICU, for being intubated, for potentially even also needing what we call ECMO. We also know in some recent data that's coming out that they're likely more increased risk for stillbirth. There's data coming out of, for example, Mississippi, where the stillbirth rate has doubled in those women that have that have obtained or developed COVID-19 in pregnancy. And we know that they're at increased risk for preterm delivery. So while the risk of having the severe disease is small, if you do get severe disease, it's much more complicated.
Okay, so one of the ways to prevent that would be to get vaccinated. What do we know about receiving the vaccination when women are pregnant?
So to be honest, the vaccine trials did not include pregnant women. So people always ask about that. So that is correct. When these trials were done over a year ago, the women with pregnancy were not involved. However, we now know, looking through all of the CDC data and then from countries across the world, that there have been over 100,000 women who have actually had the vaccine in pregnancy at some part of their pregnancy. And the data looking at that group of women has been very good, meaning that it has shown that there's no increased risk of growth issues with those babies, no increased risk of stillbirth, no increased risk of miscarriage or other pregnancy, poor pregnancy outcome.
Great, thank you. And then what about team members who aren't pregnant right now but know that they want to become pregnant in the future? And that could be women or men that want to start a family. There have been kind of rumors about the vaccine impacting fertility. Do we know anything about that?
Yes. So there is data that has now come out over the summer that has shown that if you compare women who have gotten pregnant while getting the vaccine or women who've gotten pregnant and actually have had COVID, that actually the fertility rates are better in those who've been exposed to the vaccine than those who actually had COVID themselves. So that's some new data that has come out this summer. But also just the way the vaccines work, there's been nothing that's shown that really interferes with your fertility at all. And those studies are ongoing in both men and women.
Great, thank you. So one nurse practitioner at TriHealth submitted a question and said one of the reasons that a lot of her patients are refusing the vaccine is that they say there are as many vaccinated patients in the hospital as there are unvaccinated patients. And so they don't believe that the vaccine works. Can either of you respond to that?
Sure. So that's just not true. So we know that about 90% of all the patients in hospitals, in our hospitals here in Cincinnati and in TriHealth hospitals as well as across the country, who have COVID infection are unvaccinated. Of the people admitted into the hospital, 10% or less in most places have been vaccinated. So we do sometimes see breakthrough infections in fully vaccinated people. Those are almost always in the very elderly, so people over age 80 whose immune systems may not respond well to the vaccine, or people with immune suppression, so people with cancer or who are on certain immune suppressing medications or who have certain blood diseases where they're unable to respond to the vaccine. So of the people who get breakthrough infections and are sick enough to get admitted, they virtually all have some serious underlying medical condition that keeps them from responding to the vaccine appropriately. Healthy people just don't get admitted with breakthrough infections.
Okay, and Dr. Coppage, what about breakthrough infections in pregnant women? Do we know anything about that?
So, to be honest, our vaccination rate in pregnancy is very low. So most of the time when you look at studies, only about 20 to 30% of pregnant women have actually gotten vaccinated. So we don't have much information about breakthrough rates because most of our infections in pregnancy are true new infections because the patients are choosing not to get the vaccine.
Yeah, that makes sense. Switching topics again, another topic that people bring up, we talk about avoiding hospitalization, avoiding severe disease, and avoiding death. Can you talk a little bit about what long COVID is?
Yeah, so long COVID refers to the symptoms of an active COVID infection that may go on longer than the usual, maybe 10 to 14 days of a viral infection. So it looks like about a third of the people who get COVID infection end up with symptoms that can last as long as 3 to 6 months. So those can be symptoms of excess fatigue. Some people describe brain fog. Some people have shortness of breath. And it seems like the more severe your initial COVID infection, the more likely you are to have those long COVID symptoms. So people who are admitted to the intensive care unit or have to go on ventilators very commonly have long-term symptoms of shortness of breath and breathing problems for 6 months, maybe even out to a year. For people who have milder infections, some of those people still do have prolonged symptoms of fatigue and this brain fog issue, sometimes joint pains, various symptoms that can last up to 3 months. So it's a significant issue, and I think we're barely scratching the surface on understanding what that's all about.
Yeah, we know that vaccines reduce the risk of more severe illness, of hospitalization. Do we know anything about vaccination and long COVID?
Yeah, so I mean, if you're vaccinated and you don't get COVID, you don't get long COVID. That's the first thing.
Exactly.
There have been some people who've been fully vaccinated who got mild COVID infections who do have some ongoing symptoms. So it doesn't completely prevent long COVID, but it goes a long way to preventing most cases of long COVID.
Great. The other big topic that's come up a lot in our questions is about the variants. So Delta is the variant we're hearing a lot about right now. What do we know about these new variants of the disease?
Yeah, so the Delta variant is much more highly infectious or contagious than the original variant, which was called Alpha. And so it's at least probably 2 to 8 times as infectious as the original variant. So it's just much more easily spread, and it's much more easily transmitted, especially in group settings. And that's why we're having such a hard time now with the Delta variant causing this fourth surge because it's so easy to spread. And so even in people who've been vaccinated, there's a small chance that during the early part of their infection, they could spread the disease if they get COVID. And so that's why we've all gone back to wearing masks in the hospital setting. And it's why we still recommend wearing a mask when you're out in public. Because some people who've been vaccinated potentially could acquire COVID even though they're only mildly symptomatic and could pass it on.
What about kids, especially under 12, who aren't eligible to be vaccinated yet with all these variants circulating? What do we know about COVID in kids?
Well, I mean, COVID can be transmitted in children. Fortunately, most children who acquire COVID don't get very ill, although a small percent do get sick enough to get admitted to the hospital and may even need a ventilator support. Most kids weather it pretty well, but they can be a source for ongoing infection in the community. And I think that's also somewhat of what's behind our current surge is schools have gone back in session. And kids can spread it around in school. They can bring it home, give it to mom and dad or grandma and grandpa, and it just keeps the cycle going.
Yeah. So an important next step is looking at vaccinating that next younger group. I heard that Pfizer announced last week that they plan to submit their data for 5 to 11-year-olds in the next couple weeks. So we're hoping this fall, down to 5-year-olds should be able to receive the vaccine?
Right, that's the next step. And so they will submit that data to the FDA, and they'll evaluate all the pros and cons, evaluate any issues with side effects, make sure that it's safe and effective. And hopefully, before the end of this year, we'll have vaccines for children, which is really going to be important to be allowing kids to get back to a more normal environment, especially in school and sports.
Absolutely. So we had a team member submit a question that the team member has a 2-year-old who will probably not be eligible for vaccination for a while and is being extra careful in the community. Any kind of recommendations about what is safe to do with unvaccinated kids?
Yeah, that's always a tough issue. So I think, you have to evaluate each individual activity on its own, but I think certainly activities that are outdoors are safer than activities that are indoors. Activities that maybe involve social distancing where little kids aren't in a real small, tight group is probably better as well. So, going to take a hike in the woods with the kids spread out a little bit is probably not so bad.
Yeah.
But if you're going to be at a birthday party inside where everybody's tightly packed together, that's probably going to be a higher risk situation. So I think you just have to evaluate each of those on its own individual issues.
And I think too, remembering just those common sense things like, eating healthy, get plenty of sleep, wash your hands, create your own little bubble. If there's another family or your neighbor that you're close to and you're kind of in the same predicament and you're all staying healthy and you have same age kids and you can create that kind of atmosphere where your kids don't feel isolated, but you know that you're in a sense in a safe environment. I think that that's important because we have to continue to live our lives, but we have to do it in a smart way.
Yeah, that's a great example.
And I think also, if your child is ill, get them tested. The test is easy, and it's relatively inexpensive, and it's very easily accessible. You can go to any urgent care. Most of the doctor's offices have them. Certainly all the TriHealth pediatrics offices have COVID testing available. And you can find out if your child has it. If they do, not to send them to school. They can isolate for 10 days and be fine.
Yeah, and stop the spread there.
Right,
so,
exactly.
What are we hearing about booster shots?
Yeah, so booster shots are really interesting. So the FDA and the CDC have come out recommending booster shots for immune-suppressed patients based on some really good data that particularly it was done in transplant patients where they showed that if they didn't respond to the first 2 doses, if they got a 3rd dose, there was a much higher response rate, especially for the mRNA vaccines. So this Friday, actually, the FDA is going to review the data on boosters and come out with some recommendations about who should get a booster, and maybe some people don't need a booster. Otherwise, young, healthy people who've had 2 doses of an mRNA vaccine or 1 dose of the Johnson & Johnson vaccine seem to be very well protected against getting significantly ill from COVID infection. So it may be that not everybody needs a booster, but just some people at higher risk, maybe older people like I talked about that we see in the hospital. Maybe people with some mild immune suppressing conditions. Maybe some people with some mild increased risk conditions like they're overweight. Those people maybe will be recommended to get a vaccine, so we'll see what comes of that.
So it's related back to what you were talking about which people have the breakthrough cases that are a little bit more severe, so looking at ways to help those people.
Exactly. I mean, our goal here is to keep people from getting really sick.
Yeah.
We don't want people ending up in the hospital and certainly not getting on ventilators.
Now the $1 million question. When are we going to get to take off our masks?
Kristin, take that one.
If I had a crystal ball.
Yeah.
No, I mean, I think everything that we've talked about moves us in that direction, right? Trying to stop the spreads, trying to stay healthy. But as to a date in the future of when that's going to happen, I wish I knew.
Yeah.
Yeah, I mean, so everybody in the beginning of this talked about herd immunity, and initially the thought was maybe if we got 75, 80% of the people who were either vaccinated or had the disease, it would be enough to shut it down. But with the Delta variant being so highly infectious, the experts are now telling us we need to get maybe 90, 95% of the people immune before this current wave of the pandemic will stop. So we have a ways to go. But the more people get vaccinated, the better off we'll be as a community. And the rest of the people will probably get COVID infection, and they'll end up being relatively protected, at least for a while. Yeah. So I would anticipate that the current surge hopefully will die down, maybe sometime in late October, and we might get back to where we were in June when we thought things were good. But what we have to watch out for is another variant to come along.
Yeah.
So there's one called Mu that's out there that looks like it might be a little more resistant to being suppressed by vaccine immunity. And whether or not that one will end up causing problems, we don't know yet. So far, it really hasn't. Only less than 1% of the cases in the U.S. are due to that variant, but it's something that the CDC and the World Health Organization are watching closely.
So we all kind of have an ability to impact that. We have an ability to impact when we can get off masks and some of the variants by getting vaccinated, right? And by testing when we're sick and trying not to spread and decreasing some of this in the community.
Yeah, absolutely. We know all the things that we need to do. We just have to get the most everybody doing it, and then I think we'll, be out of the woods.
So these past 18 months have been really unprecedented, especially for healthcare workers. How can someone get help in healthcare if they're feeling isolated, depressed, burnout with the current situation?
So I think from each health system, probably through their employee health as well as their human resources, usually has a program that's set up. For example, here at TriHealth, we have our EAP department that is there to support people. There are especially different groups across our community that are available. So, for example, in physicians across the community, there's the Lindner Center that offers that support if needed. But I think that also just garnering that support at home from coworkers, taking on new hobbies, being able to get away to de-stress, meditation, you name it. There's different things. I think we have to realize that we have to be able to take care of ourselves just as much as we're taking care of our patients.
Absolutely.
Yeah, I think that's really important. Whatever you do to relieve your own stress, to unwind, you should be doing lots of it right now.
Yeah.
And reach out to your fellow team members, because everybody's feeling it. And sometimes just talking to team members about, how under stress you feel can be helpful.
And realizing
and they're going to be feeling the same way.
Yeah, realizing that we're all in this.
Yes,
in this
exactly.
together. So we've talked about lots of interesting topics. As a wrap up, what would each of you say to someone who is deciding about getting vaccinated or not?
Mm-hmm. So I think I can speak to just the pregnant women out there, or women of childbearing ages, that I would highly suggest that you get the vaccine. Here at TriHealth, we have taken care of more than 750 pregnant women who have had COVID over the last 18 months. We have seen the significant risk it puts the pregnancy at for both the mom and the unborn baby. And we know now there's enough data out there to show that there's really no risk to you or your baby, and it's actually extremely beneficial for the two of you to get the vaccine. So I would hope that you would consider it as a way to protect you and your baby from the significant risk factors that are posed to you from COVID.
Yeah, I certainly couldn't agree more. So COVID infection is a bad disease, and the vaccines are incredibly safe. And any concern you might have about the vaccine is magnified 100-fold if you actually get the disease. You can protect yourself from getting seriously ill, ending up in the hospital or on a ventilator, or getting long COVID, which a lot of people are suffering from, by getting a vaccine. The vaccine may give you some temporary discomfort for a day or two, but then it's gone and your body's primed and ready to fight off COVID when you might come across it. And that's really the best way to protect yourself and your family. So whatever you can do, get a COVID vaccine.
Great. Thank you both for taking the time to have this discussion today.
Thank you.
Thank you.